DCarsonCPA.com, DCarsonCPA.net, and GRL STEM, macro and micro lines into a mosaic format for strategic and operational views to entities and to where entities fit in the puzzle of entity policy and community lines to help on GRL STEM lines of engineering, where financial, legal, technology, and teamwork come together. Of course, there's much more to it than that. But in this, we're just looking at the broad lines. It's the time of COVID crisis, risk models in that respect, and thinking about it, seems that there's not a good numerator-denominator modeling in place. So in the abstract, we're looking for a model where there's health economies there. Health economy in the numerator is a subset of the denominator, which is GDP, the fiscal economy, and that includes a subset of the health economy. But in order to have a rational model, and rational model not because human costs are not considered, of course they are. Life of, the human value is sacrosanct. It's something that we really can't place value on. However, for the purpose of health, insurance, risk management, you have to ascribe a value. And that's what actuarial science is all about, looking at statistics, looking at contribution models. And in the model, we have to ascribe some value so we can plan, and we have to get the economy back in a roll, but we have to find the right break-even point of cost-benefit, wherein you're protecting people, you're doing the best you can on that front, minimizing casualties and doing the best you can, but also keeping the economy moving, because if the economy starts to fall apart, you have other problems, and there's inherent problems in a lockdown in the economy where you have people that are not able to exercise, health conditions that could be manageable get worse, you have the position of people perhaps isolated. That creates psychology problems and can lead to other factors in the economy. And of course, you've got cascading issues where if people can't get out and man the logistics lines, or man and woman the logistics lines, what happens is you can have what almost happened with the meat supply lines of cascading issues. And that, for example, is you have one source of protein, the processing plant closes down, puts pressure on the other lines of protein, and then as pressure moves from one good to a substitute good, there can be a ripple effect of that, hurting that, and doing a lot of things that are difficult in the economy. So we've been thinking about this all, and we're kind of in the VUCA risk chapter of the economy and financials right now. We're thinking about something that's come up. Previously, we were focused on bad actors risk, of people that wanted to do things to hurt us as a people. There'd been environmental events like Sandy and different types of environmental things which happened and hurt insurance. And now we're into the pandemic line, certainly a line that no one prepared for, a question of a line if it was some sort of man-made error, if it was an intentional action, or if there was other lines. It's all to be discovered, and they have cases that'll be going on, and that'll lead to a lot of forensics, which will explore the birth of COVID and what we sometimes refer to as a COVID hydra, just because that one crisis takes on so many other forms. Then you look to the VUCA risk line. The VUCA risk line collects what was the pre-existing risk state to the current state risk of the pandemic that we now have to map in. And we're kind of looking at the lines as numerator-denominator things. It's a logical thing we've had around for a few days. It's been what you're thinking about with your forecast, with your plan, your budget in the world of financials. How much you're going to spend for the yield. Is a little bit of another way of saying it. Cost benefit, the weight of the event to the whole of events that are going on. And while the COVID crisis is a crisis of magnitude, we don't want to see anyone suffer. We want to be able to help everyone. But the problem is we have to manage other events so that one event doesn't become a series of cascading events, which tanks the economy. And it seems like now we're starting to see points that are critical and can put pressure from one point to the next, and that's a dangerous thing. We think about this numerator denominator. The way we think about it right now is that we need the health economy and the cost of mortality weighted in, and that put in perspective the whole economy, and that gives us a numerator denominator. A way that we look at currently at insurance and health. That's the way health policy, insurance policy is priced out, financial policy. It's got to go in that actuarial direction so that we're managing this in a logical way, not because, it's a matter of the difference of the value. We're all important, but it's the issue of keeping things moving. And, if this is not correctly managed, let's be precisely clear. What happens is that you've got a global national crisis going on. A risk model is needed. It's not in place. It's encompassing security, logistics, supply chain, cybersecurity, and then the issues of defense, acts of God and nature that are occurring. So there's kind of a whole risk profile here. And then looking into the sustainable, you want to look at the sustainable risk lines, which is the cost benefit of being closed and how long we can run that. And cost benefit is very important. And here's the thing with all of this, what was very late flowing to the model, at least in the tri-state area, and we could say specifically in New York where we're following some things, that the governor and the mayor were quick to communicate and very strong in communicating. However, one of the points that was not very well covered in the communication, and not causing fault, obviously we're all going through a crisis the first time we saw it, but to learn from the crisis is to know that we need to face it in better ways looking forward, is that there didn't seem to be something that would have helped us, and that would have been a model of policy and cascading risks in itself. So right now we're working a little bit to better define this. This was just a quick map, and what we wanted to say to complete that thought that I just had, so when you hear it, you get it in context, was that there was a lot of fear-based reporting about what we had to do, and there was a lacking line of actuarial and the people that own the numbers, for instance, the actuaries, the health statisticians, the comptroller of the state of New York or the city of New York, focusing on the local level and then going back out to the federal level. Of course, that analysis at work, there's different places like GAO, Congressional Budget Offices, if it's a legislative issue they're putting together. But that does not seem to be happening out front. The numbers are there, but we're kind of not clearly locking into health models. And what I wanted to say was 5 to 6 weeks, we're even looking for the things, they started to bubble to the surface. And that's a long time into a risk to start to get some clarity to what the crisis is and what's going on, to start to get some banded statistics. So all healths, if you don't know it, work with statistics, that those statistics feed insurance and health policy models. And so when we're in a crisis, those statistics should be coming in real time. And what we should be working from is a predictive model. Even if we don't have great figures, we should be able to say, this is the best model we have, look at the model, this is what we think it's going to be. And then each day as actuals come in, you do kind of like what you do with financials. With financials, you have a plan, forecast, plan, budget, forecast. You have a model that's going out. And as your actuals come in, you're truing up and you're scoring to that. And you'll be improving the model. And this is going to be long now, longer than I wanted it to be. But inherent in the risk lines, what should be happening is that model needs to be checked in real time. You need auditors on it. You need actuaries. You need statisticians. You need people checking the assumptions, because even the smartest of minds in the economy, there was 2 years back, there was a Harvard economics, model, and that had a flaw in it. And a mathematician looked at it and someone found a flaw, and, the greatest of minds can make mistakes. And so what we need is models to cross-check. And if we have cross-checks and compensating controls, as we call it, we get a better model in the end. And so that leaves the last point, as health being a subset of the economy. With this risk model, missed opportunity is to have a federal model, which is looking at numerator, denominator, health of the economy, and then have compensating state and local models, because you might have that on other things, but we didn't seem to have that thing. And a compensating model wherein we could say, and I'll put it right in here because it's the missing piece here, is this federal, the Fed, the state, and the local. That added in, if you have 3 points in a risk model, what happens is the Fed can have its model of what it thinks happening. The state can happen, the state can have, and the local can have that, because they already have actuaries, demographers, and comptrollers. So you can leverage on those in-place resources to build a model. And then in between the Fed and the state, we should have regional, I want to say, but before that, multi-state. So multi-state and regional models of risk. Those are things we don't have yet, but we're kind of, through the analysis of this, going to push a little bit more in an idea that's come together on how to help here. And so I'm Dean Carson. The point of all this is to help, not to hurt. We're not saying that, we're noting that it's imperfect, it's a tough time we're going through, and we all have a role to help out. And so what we want to say in the last on this is hashtag strong civics is where we're coming from. Strong civics is the goal to help out. We've all got skills in different ways, different areas of expertise, and we all have capacity to look at things and think about things in ways that can help with teamwork. It's the benefit of diversity within the team. It's what makes us great as a nation, that we have lots of different people with different views and different learning points. And when those views come together, we get something stronger out of it. So there's our contribution to the line to help out. There's many people who deserve a lot of respect that are out there working on the front line, and this wouldn't be taking away a thing from what's being done. Rather, the goal is to help out, because we don't want to win on one front and then not have a total win on all fronts. We want to make sure that the wins we have, like in any field where there's a lot going on, are compensating wins that work with each other. So in the aggregate, we come out okay, and we come out a line ahead. We've got to be careful, because right now a lot of spending is going into the fiscal budget. The fiscal budget is a challenge thing already before this came, the on and off budget lines of the federal government, of pensions, of insurance, and funds and things like that. There's just a lot at play. So we really need to be thinking about how do we take this experience and what was good and bad about this. And I would say this is a very preliminary thing. I'm going to tighten it up, come back and do it better again. But one of the first things that was very difficult, and I see it now in my local area because you see some 10 to 15% of people come out without a mask. And that's because we're not getting good communication from the top level of the actuarial models and stuff. We're not getting good communications of what's a cause. And if in fact this was something like an intentional crisis or an inadvertent crisis where something's released, it would warrant the level up of saying, look, this is almost like someone, had left something with us that had a fallout element, because you would manage it in a different way. And it'd be much easier for the average citizen to, with confidence, approach another citizen and say, look, what's a task here is your freedom and liberties, what you're being asked to give up, and what's the benefit is our unity and what we can do together to help each other. And we want to know, and the more we can quantify and weight and measure it and put it in, then the more we can have good decision making, good policy, and good teamwork. And so what I want to say at an individual level, it's hard for me to see someone without a mask. You have a strong feeling about that. But if I don't have a good model where I can understand and see what I'm saying, I'm not going to go to tell someone, the public education part is hard, because are they right in taking that step for freedom and liberty to not wear the mask to feel that they should be more free? Or is there something more at play that's not being adequately described? And those are two valid points you can go at an angle of when you see someone like that. It's they have the right to freedom and liberty to do what they want to do. But if this is a massive crisis, you also want to get them managed in a position where they understand just how important it is. So there's a heck of a lot of play in this time. In general, what's happening to the economy and with mortality in people. Our hearts and prayers go out to people on the front line, people being affected, families. And there's also a cost of people not being able to get together in congregation to practice their religion, to think about things in that respect. And faith is important to elderly people who are in positions where family can't visit them, and sick people too. And so when you ask that they no longer be able to congregate and have to stay in space, there is just a lot that's coming into the picture. So we all have to think about this, and it becomes a model for what was apparently an underprepared area of risk management. So to say quickly, I think COVID crisis brings to us something important. It's an area of risk management for the interlocking lines of policy that have some room to help in improvements, to get risk models in there that are numerator-denominator modeling and thinking about cascading outages and what can happen. Because when we have concentration in the market, we have a lot of offshoring in our production lines. This is all something big that needs to be thought about and talked about. And it's going to take a lot of people to work together and think of smart solutions. We can do it, we can get there, but we've got to be studying in real time, learning, measuring our models, and correcting our passage. It's almost like, working on a rocket with a trajectory to reach a destination, working on an airplane. It's an engineering problem, because each time we've got to think about our actual performance, where we are in the map, and how we can improve that. And so the purpose of COVID crisis modeling in this respect is strong civics to help out federal, state, and local lines and policy, and EPC lines, which is entity, policy, and community coming together on teamwork. That's not in here yet. So this is a massive model I got to put up and bring together, but this is just a quick abstract to be up. We'll be back to it. We'll circle back. We'll give you more details, and we'll tighten it up so it's a cleaner presentation. But at least we wanted to let you know we're on it, we're thinking about it, and we're working for our ways to help and to support in other ways too. Do your part, be helpful where you can, learn as much as you can, and use that knowledge to contribute to your entity, to your policy, to your community, to help stakeholders and help us all improve in teamwork so we can do the right things together and help fix this, get this crisis behind us, get into recovery, and do what we need to do together. God bless, be strong and be well, and we'll be with you with more soon. Thank you.